Hey everybody, we are back, and today we are rocking it with the docs at the Functional Health and Wellbeing Center. We have Mary Ellen Francis Connie, Dr. West, and Jane Snyder with us today, and we are going to continue our discussion on nutrition because that's our focus that we're kicking off the year with. It's February, it's Heart Month, we're all wearing our red, and so today we want to dive a little bit deeper into some other topics that are connected with the heart and nutrition, one of those being cholesterol. So let me start out with Doctor, give us the news. Okay.
Yeah.
What is cholesterol?
Yeah. So cholesterol is a fat that the body makes. It's influenced by many things, nutrition being one of the main things, but also stress, sleep, and exercise for sure.
Okay.
And, cholesterol, I think, gets a pretty bad rap most of the time, but we actually need cholesterol to survive.
Amazing.
Yeah. So cholesterol is the building block of every single cell in our body.
Okay.
All right. So we need it for those cells to form and survive. But past the cells, it's super important for our bile production, and it even starts the whole hormone process. So without cholesterol, we would not have any hormones.
Oh, that's amazing. Yeah. So it affects every single one of us, no matter what age we are. Mm-hmm. Cholesterol plays a huge part in our body. So that's incredible. So obviously you just mentioned our bodies do need cholesterol, but what are the symptoms of cholesterol?
Well, I think that's a trick question because there really are no symptoms for high cholesterol. So you have no idea unless you get it checked.
Yeah. And that's the important thing. And that's really what goes along with heart health, because a lot of the symptoms that are connected with, whether it be the cholesterol or high blood pressure, a lot of times they don't come with any symptoms. There's nothing telling us like, hey, you should really be concerned about this or get this checked out. So where does nutrition play a part in all of that?
That's complicated, right?
Yeah,
That's a big
one.
That's a big session, but let me just give you a few things on that. So I think that unfortunately the whole low fat movement that was in place in the 80s is still present today. So I think there's a lot of misunderstanding about what causes an elevation in cholesterol for people. So we try to educate folks that it is not necessarily the fat that they're eating in their diet. So we're always going to encourage people to eat healthy fats, and that's not going to harm your cholesterol. What really drives up cholesterol in people, and typically, especially in America, is the standard American diet, as Jane mentioned, carbohydrates, sugars, glucose, all of that in processed foods. It causes inflammation and it causes the cholesterol to go up. So sometimes I tell folks, think about diabetes and the things that you would be trying to eat when you're diabetic. Those are the same things that are also going to lower your cholesterol. So lowering those carbohydrates and processed foods and sugars.
Yeah, and sugars really is the a main key there. If you're going to watch your sugars or your fats, you're better off getting rid of the sugars, correct?
That's right. Yeah, that's right.
And one of the main reasons for that is that sugar creates a response for insulin. So the more sugar you eat, the more insulin your body is going to produce. And insulin is one of the most inflammatory compounds that our body makes.
Yeah.
And the true story behind heart disease and cholesterol is that it's not just the cholesterol. You need cholesterol and inflammation, gasoline in the match, to cause the issues in the arteries. So the reducing your sugar intake, starch intake will presumably reduce your insulin, which then is able to lower that inflammatory burden to maybe not make the cholesterol as damaging.
Okay. And what role, when we were talking earlier, you gave a really good example of what is going on inside our body, like how that is all getting processed through the heart and through the liver. And so it's not even just about the heart, but your liver is doing a lot of processing, your kidneys are doing a lot of processing. So what does that all look like from a quick picture of what our bodies are doing internally?
Well, I usually tell people there's two major ways that you end up with cholesterol in your bloodstream. You make it in the liver and you reabsorb it to a lesser extent, but reabsorb it from the gut. So those are two pathways. We all know about statin drugs to lower cholesterol. Statins block the liver end, okay? And there are other medications that block absorption through the gut. So those are the two major pathways. But cholesterol itself, when you talk about what does it do, what is the function besides, in terms of being building blocks, etc., is also the way that we've sort of started to name cholesterol incorrectly.
Okay.
That it got its nickname of good cholesterol and bad cholesterol a number of years ago when it was determined that cholesterol made in the liver was carried to the arteries and as LDL.
Okay.
Okay. And then it, obviously in high amounts causes damage to arteries, no matter where the arteries are. And they learned that cholesterol was removed from the arteries by HDL. So it was, oh, I see. The stuff going from the liver to the arteries, that's bad. So that's bad cholesterol. So LDL got the label of being bad cholesterol. And hey, this HDL stuff takes it out of the arteries back to the liver for processing. That's good. So we're going to call that good cholesterol. And in fact, it's really just a transport system.
Okay.
It's neither good or bad. It's, it's trucks on the interstate, just
Good.
going back and forth.
Well, that's good to know. Yeah, because, we hear that a lot. And, I'm a patient here at the clinic. So I like the fact that when I'm here, we're talking about those LDLs and those HDLs and what that means. And that can be pretty confusing. So we want to make sure we're getting that message clear. So getting away from the good versus the bad and just really focusing on what we're doing to lower that cholesterol.
Mm-hmm.
And we were talking how important does movement play in our nutrition, in our cholesterol, and especially in our heart health?
Yeah, that's a great question. We love exercise. We love move. We like to call it movement because we don't want people to think they always have to go to a gym in order to get their movement and to get their steps in. But exercise and movement really help. And one of the ways they help is it's the only thing we know that increases the HDL cholesterol.
Okay.
So that's a real positive benefit. Exercise is really extremely good for your cardiovascular health. If you think of that as all of the blood vessels and arteries and veins running through your system, when you are exercising it is a much more healthy system. It's more buoyant, it's more resilient, and it's less inflammation. So we're always going to plug exercise. And I think, when you talked about heart health, a lot of people just focus on cholesterol readings, but we try to really educate people. It's so much more than that. When we are looking at cardiovascular risk factors to prevent heart disease, we're really looking at the gamut. Cholesterol is only one piece, super, super important, but cholesterol, how is your sleep? How is your stress? What kind of inflammation do you have in your body? And we test for a lot of those things, especially with inflammation. We test for those things here so we can really see what's going on for that patient.
So we need to point out the fact that the heart is a muscle. So when you hear a lot about like getting up and doing that aerobic type exercise and getting your heart pumping and moving, that's really plays such a huge part in how your body is able to process things. And so, it's encouraging to get up and move. And there's a lot going around today about the fact that sitting is the new smoking because we're not moving.
Yeah, absolutely.
Yeah.
Yeah.
So,
I think there's a lot of research around even breaking up periods of activity throughout the day. So I've seen some things where it says if you sit for 8 hours and then you go to the gym for 45 minutes, it may not be as beneficial as taking a 15-minute break multiple times throughout the day and just moving your body and walking.
Yeah. Yeah, and that can be as simple as walking. It doesn't require that you be in the gym for, long periods of time or things like that. But, you can increase that aerobic exercise simply by, maybe walking a little bit faster, maybe at a faster pace if you can. So really just making sure that you're getting that movement built into your day every single day. So it's really important.
Wanda, we've talked to our patients about desk exercises, and I'm sure you can Google them, but every hour taking having a little timer that go off, and maybe you do 10 desk push-ups,
Oh, nice.
right, in an hour. Then the next hour you get up and you do some stretching. So there's ways you can do it at your desk if you're not able to physically go and leave for 15
Mhm.
minutes to do a walk.
They have those under the desk, those pedalers
Pedals.
that people love,
Mhm.
and those balance boards. There's a lot of different
Yeah.
things out there
Yeah.
now.
Yeah.
Especially since a lot of people are working from home, things
Good.
they
Yeah.
can do at home.
I have an under-desk treadmill.
Nice.
It's more of a walking pad than a treadmill.
Good.
And you just slide it under there, put it slow, and you can still, work on your laptop while you're walking. You can get in a 5K.
Be careful. Be
careful.
careful.
If you can do two things at one time.
Oh, it's
That's
amazing how you learn to do that.
That's good.
Well, the other important thing I want to mention, I don't remember, you'll probably remember the numbers, statistics of when we're talking about cholesterol. Is it 50% of the people
Yeah.
who have heart attacks
Right.
have a completely normal cholesterol?
Okay.
And it's just, we need to get that word out there, because people may get a positive, a check plus when they go to their annual physical and their cholesterol is normal. That does not mean it doesn't mean it's good, but it doesn't mean everything. That's not the full picture. So we do a lot of advanced cardiac testing here that looks at some of your genetic components and some particle numbers, and just advanced understanding what type of particles you have. Are they big and fluffy? Those are less risky. Or are they small and dense? Those are more risky. So those things are really, really important, because again, the whole picture is not determined by your simple cholesterol panel.
Those are newer tests, and they haven't really caught on in mainstream for whatever reason. But sort of I think that's a coming thing, and we've been doing it for a long time here, looking at things like what are called particle sizes and particle numbers.
Good. We hope this information has helped you. The more that you know, the more you can control. So stay heart healthy, go out and get some movement in, and thank you for your time today. So if you have any questions for the doctors today, send them to the Wellness Committee at us-wellnesscommittee@phoenixcontact.com.